Bo diddly, have you heard? Everybody knows that the bird is the word.
Colic is a very common ailment of infants, and basically it's digestive distress. I assume the infant is experiencing painful cramping, and this is expressed as crying. Russ can talk about the criteria by which we define colic, but it's a bad thing for both for both infants and parents. However, many experts feel that colic might be a normal phase of development of the intestinal tract. So it's something that can be dealt with symptomatically. You want to try to make babies more comfortable, and there may be some methods for preventing it or reducing its severity. So do you want to say more about colic?
Sure. You know, it's just as you said, Andy, one of the first challenges that a parent may face with their newborn is colic. And usually starting around 3 weeks of age, the child starts crying and doesn't stop for a prolonged period of time. And it's very distressing for parents, and it seems uncomfortable for the child. And we really don't know what causes colic. Some people think it's just immaturity of the nervous system or the gastrointestinal tract. Some people think it's an accumulation of gas from feeding or the crying itself.
Or foods the mother may have eaten.
Exactly. Sensitivities, from the foods the mothers have eaten and then getting in the breast milk, caffeine. We're not real sure.
How about swallowing air?
Well, this is one of the things, it's interesting because a lot of people feel like that kids with colic have an accumulation of intestinal gas. And it's not uncommon for kids to, pass flatus, to pass gas, to burp a little bit more. And that's where a lot of this, consideration has come from. Now, is that because the child has swallowed a lot of air during the eating process? Is it because of swallowing a lot of air during the crying process? Probably a combination of both. And as you said, for each child, there's hopefully that right recipe to try and help them feel a little bit better. But the first thing that we tell parents is, if your child is distressed, you got to make certain that you can find some calm yourself. And that's where those breathing exercises and doing a little something to manage the stress. But then what a lot of parents have found works is, taking a ride in the car, sitting by with the child and holding the child as the dryer is going or the washing machine, some kind of motion, a rhythmic motion, putting them in a swing. Gentle massage sometimes work. We usually call the position the flying baby position, where you're holding the baby on its tummy and just swinging it back and forth, and gentle music, anything that you can find, that gentle rocking motion, burping the baby perhaps a little bit more frequently during feeds. Hopefully you find a little something that works, and over a period of usually within a couple of months, the colic subsides.
Good. Would you also say it's important to rule out other possible causes there, because there are some conditions that might be mistaken for colic, such as gastroesophageal reflux disease, which can occur in infants.
Right, and probably GERD or gastroesophageal reflux disease is the most common differential here, and that's one of the distinctions here, is that kids with colic want to eat, and they still like to be held, and they're hungry. Kids with gastroesophageal reflux disorder or GERD typically have pain when they eat, and they're not as interested in eating, and they're not gaining weight as well. And so there's a significant distinction there. And in addition, if the child is running a fever, or if the crying is persisting for hours on end, or if they're not acting normally, if they're more lethargic or things like that, that's the time to really make that quick phone call to the doctor and say, this doesn't look like colic.
Candy gets too sweet. Go to a dentist and fix your teeth. When your teeth get fixed just right, go to the Apollo on a Friday night and see Bo Diddley. Gonna see Bo Diddley.